This segment is sponsored by Sleep Better Columbus. Sleep Better Columbus says that your sleep is their business, and their main goal is in the name, to help you sleep better. And the way they do that is with these two professionals right here, Dr. Mark Levy and Dr. Don Slaybach. Good to have you guys.
Thanks for having us.
Good to
So
see
Dr.
you.
Levy, you have so much experience in the medical field. Why did you decide to hone in on sleep apnea and all the medical effects that comes with that?
Well, a large portion of my practice was treating TMJ patients. Those were patients with migraines, constant headaches and such. And there were a few that I just couldn't get relief as much as I wanted. And I started investigating things, and it turns out that there's a very strong correlation between TMJ, headaches, migraines, and sleep apnea. So after I did my research, got my training, I've learned that now if someone comes in and they have both, we obviously have to treat the sleep apnea first, because you don't die from a headache, you die from sleep apnea.
Okay.
If we're treating the sleep apnea, more often than not, headaches start to go away.
Wow. So what does a typical appointment look like to treat that right now?
Well, once we do an exam and evaluate the situation, we take impressions, and we do that with a digital camera now. There's no more filling your mouth with all that impression junk.
Oh, I remember those, the metal in the jaw.
Yeah, none of that anymore. So we take the digital impressions and email the data to our laboratory. A couple weeks later, we get the appliance back and make sure it fits properly, give the patient their instructions, and we normally schedule them back in about a week just to make sure it's comfortable and make sure everything's going okay.
How rewarding is it when you hear the
unbelievable.
testimonies of patients that they finally get a better sleep?
Not only that, we get couples back together. Lots of times these patients are not sleeping in the same bedrooms with their partner. So we get partners back together, and people are feeling better.
Now, Dr. Levy, I know you have the alternative in your hands to the CPAP. Talk about that.
Well, this is one of the examples of the appliances that we use. It's basically made up of two retainers that are connected, and it repositions your jaw when you're asleep. It's very comfortable. I've been wearing one for 8 or 9 years. Easy to adapt to, and when we hear patients coming in comparing this to the CPAP that they were not able to wear, they're ecstatic.
That's incredible. Now, Dr. Slaybach, your background is so incredible. Everything from biochemistry to dentistry. Talk about how you specifically treat it and what draws you towards helping people in that case.
Well, I took kind of a similar path to Dr. Levy, where I started out treating patients with headaches and TMJ disorders. And there just seemed to be a missing link for some of those patients, just like he said, that we couldn't get to the results that we really wanted. And started looking at airway and realizing that both of these disorders, whether it's head, neck, and facial pain or airway disorders, are basically diseases of the same anatomy. That if the jaw's in the wrong position, then it can close off the airway and also cause headaches and joint issues as well.
And serious headaches are such an issue. How do you diagnose that specifically to know the difference?
Well, we have several. It's like putting pieces of a puzzle together. We use some technology that allows us to analyze bites, so the teeth component. We have other technology that actually allows us to analyze the joints themselves. We do some muscle testing. We take 3D imaging of the entire head and neck region. So we kind of pull all the pieces together and come up with a diagnosis.
It's just incredible, though, that you are able to treat it. You have an incredible practice here. Dr. Levy, what's the first step people need to take to schedule an appointment and finally get that better sleep and that relief?
So first step is the phone call. Sleep and TMJ is usually covered by medical. Sleep is also covered by Medicare, which is nice. So we do our homework for the patient, find out what their insurance is going to cover as much as we can. If they've already been tested, we call the source and get a copy of the test. And from then on, come in and we go from there.
Perfect. And Dr. Slaybach, is there a website people can go to find out all the information?
Absolutely. They can go to sleepbettercolumbus.com. That has all of our information about sleep as well as head, neck, and facial pain, headaches, and such.
For more information, as they said, just visit their website, sleepbettercolumbus.com, to sleep better.
Well, hello Monday. I know they always seem to come quick, but there are things that we can do on Sundays to embrace the Monday shock a little bit better. Have your weekly schedule planned out. What are the things that you need to accomplish? What are your goals? Having a simple plan for the week is a great start. Next, I know we all like to binge watch our shows late night, but try to cut back a bit and get into bed at a decent time. And speaking of bed, make sure to shut down your technology and put the phone away. Skip out on cocktails and caffeine. Let yourself unwind naturally. Make every Monday great so that the rest of the week can only go up from there.
If you're struggling with sleep apnea or snoring, then make sure to contact Sleep Better Columbus at sleepbettercolumbus.com or give them a call at 614-300-6844.
If you've been diagnosed with sleep apnea but don't want or don't use your CPAP machine, Sleep Better Columbus can help. We take a different approach. Using a dental appliance, we can treat sleep apnea, snoring, and the conditions associated with them without a CPAP. As an in-network provider with most insurance companies, Sleep Better Columbus is an affordable solution. Experience restorative sleep again and regain your health, energy, and quality of life. Call or visit sleepbettercolumbus.com to schedule an appointment.